Good afternoon, everyone. My name is Osiris, and for the past 2 years, I've been an intern at the MS Quality of Life Project, which is a local nonprofit located in Monterey. As stated in their name, all the services they provide are for people living with multiple sclerosis, their family, and their caregivers. They include various services such as case management, support services including water aerobic class and support groups. They also offer educational events and a support group, like I said before. What's really important about this is that all the services provided to the clients are free. So they never have to pay for anything, which is really nice. And then during my time at the MS Quality of Life Project, I had several duties. One of them was to assist the executive director, the program supervisor, and the case manager in various things, such as completing the quarterly check-in calls. And these calls were done 4 times a year to identify any new needs the clients might have. So for example, I would call a client and ask them how they were doing, and they could go ahead and let me know that they've been having difficulty getting in and out of bed. So that right there, it's an identified need. So I would go ahead and contact them with other services such as medical equipment that can go ahead and assist them when getting in and out of bed. And then if we found out that the need was greater for a client, we would offer them a one-on-one case management. So this would consist of a home visit, a home assessment, and a biopsychosocial assessment to identify any other needs that the client might not even see within themselves. I would also complete the quarterly statistics, and these quarterly statistics are for us to keep track of how many calls we've done with the client, how many calls we've done for our clients. These are calls to neurologists, vendors, like wheelchair vendors, insurance companies, anything to better the quality of life for our clients. I would also go ahead and attend educational events, workshops, and support groups to further my learning during my time at the MS Quality of Life Project. And last but not least, I did mailing, which is important for us to do in order to inform our clients of upcoming events and support groups. So during my time there, I needed to identify a need in order to address in my Capstone project. And so I identified that a lot of people living with multiple sclerosis oftentimes lack physical activity. And research shows that despite the abounding evidence indicating the benefits of regular physical activity for overall health and wellness, individuals living with disabilities are less likely to engage in physical active lifestyles than those without disabilities. And this is because there are various barriers to people living with MS. For example, their attitudes towards physical activity. Oftentimes individuals with multiple sclerosis fear that their symptoms might worsen if they participate in physical activity. Also, they have fear of injury. In addition, the lack of accessibility to public places. Individuals with multiple sclerosis, approximately about 50% of individuals with multiple sclerosis will require the use of a walking aid, and 10% will require the use of a wheelchair within 15 years of having MS. And then I think one of the more common reasons why people with multiple sclerosis don't participate in physical activity is because of fatigue. Nearly 80% of people with multiple sclerosis experience fatigue throughout their daily life. And so in order to address this issue, I decided to implement an exercise workshop, which our goal was to educate clients about the importance of exercise and also teach them of exercises they can go ahead and do at home, sitting down or standing up. And so in order to implement this workshop, I went ahead and did research on the issue. I also went ahead and collaborated with Pacific Physical Therapy, which is a local physical therapy located in Monterey. I also went ahead and created an agenda, an exercise booklet, a presentation, and a flyer. And then here is a picture of the flyer that we had sent out to all of our clients. And then right here is a picture of 2 exercises that we had shown in our exercise booklet. So as you can see, it's both written and demonstrated on how the client can do the exercise. And so in order to evaluate the workshop success, I went ahead and decided to focus on the number of clients who attended the event. And I also went ahead and conducted several surveys. One of them was an introduction survey, which kind of gave us kind of our background on how the clients did, how much they participated in extras prior to the event. And then the program evaluation was a survey that kind of told us whether or not the information that they had learned at the event was useful or not for them. And then 2 weeks after the event, I went ahead and did an over-the-phone survey where we asked the clients if the information provided during the event was useful or not, and if the exercises that they had learned, they had been able to put them into practice. And so overall, the Never Stop Moving Wellness Workshop was a very successful event because we had a total of 15 participants attend. 11 of those were clients and 4 of those were caregivers. And then with our phone survey, we had asked the clients whether or not they had been able to put into practice the exercises they had learned. We had 5 clients who said yes, they had been able to go ahead and exercise from the exercise booklet that we had provided to them. And then we had 3 clients that said no, and 3 with no response. We weren't able to go ahead and contact them. What was really nice though was that out of the 3 clients that said no, they weren't able to put in practice the exercises they had learned in the booklet. We had one of them who had joined the gym and so did several walking and various aerobic exercises. And we had one who was motivated enough to have her primary doctor refer her to a physical therapist. So she will be starting physical therapy soon. So in the workshop evaluation survey, which we had given to our clients at the end of the event, we asked them 4 questions. These were the two most of the important questions. One of them was if the facilitator helped them understand how the workshop material related to their own life. Out of the 12 clients who answered the survey, we had no negative responses. We had 10 who strongly agreed and 2 who agreed. And then on the statement when we asked them if the skills that they had gained were useful and if they were able to apply them to their own lives, like we said, we had no negative responses, and we had 11 clients who strongly agreed and 1 client who agreed. So overall, a lot of the feedback that we had received from the clients was very positive. We definitely see that they really enjoyed the workshop and they had learned a lot and were motivated to start exercising. And so my recommendations for the workshop for next time are to mail the clients a flyer due to the fact that a lot of clients don't have access to the internet or do not know how to use a computer. In addition, I think it would be very helpful for us to incorporate nutrition information due to the fact that a lot of the feedback we received from the clients was that they demonstrated an interest in learning about nutrition. And then my recommendation for future interns when it comes to being at the MS Quality of Life Project or any other agency is to not be afraid to ask questions because our mentors are there for us to learn. So I think it's important to ask a lot of questions during the overall process. And then a really important one is it's never too early to start your capstone project. Due to the fact that sometimes you might have everything ready and someone might cancel out on you, or you might feel that, or you are not going to be able to book a room that you thought you had originally were planning on booking had booked it. And then what I learned during the overall capstone project, like I said, it's never too early to start your planning for your capstone. If you're going to implement it during the fall, go in during the summer. You know. Also, I learned how to collaborate effectively with other agencies. And then I think most importantly, I learned that I'm capable of working on a professional level independently. A lot of this work, I did it on my own, so I feel very proud now that it's all done. And then at this time, I want to take the time to thank the MSQLB staff, Grant and Angie, and then Andrea that's not here, for providing me with a lot of support and teaching me valuable stuff. I want to thank my that I learned, I'm able to put them into practice, and I feel that I'm ready. You know, I'm ready to go out into the world and put what I've learned into practice and go ahead and get a job. Thank you.